action is needed now to address the fentanyl crisis. That's why I rise today in strong support of H.R. 467, the HALT Fentanyl Act. Fentanyl is the top cause of death for Americans 18 to 49 years old. In my home state of Kentucky, illicit fentanyl overdoses represented 70% of all overdoses in 2020 and 2021. The fentanyl crisis is one of the foremost problems that American public faces and is being made worse by the crisis at our southern border. Illicit fentanyl is turning virtually every community into a border community, with these poisons flooding streets across America and taking innocent lives, including the lives of our kids. The HALT Fentanyl Act would ban all fentanyl analogs and strip the drug cartels and other criminals of the incentive to create new versions of fentanyl to skirt around the law. This bill is a key step to help get these poisons off our streets and give law enforcement the tools they need to crack down on illicit fentanyl trafficking. A two-pronged approach to addressing this crisis is needed. We must have a law enforcement and a substance use recovery strategy to address this crisis. That's why I look forward to examining the Support Act for Patients and Communities Act later this year to continue providing access to treatment and recovery support services so that many individuals that they rely on throughout our country. To those who oppose this legislation on the grounds it could lead to mass incarceration, the emergency class-wide scheduling implemented by President Trump did not lead to mass incarcerations. In a Government Accountability Office study from 2021, the GAO found that there were only 8 prosecutions, yes, 8 prosecutions during the period in which the Trump administration temporarily scheduled fentanyl-related substances as Schedule I drugs from 2018 to 2020, with 4 of them being individuals working on behalf of the cartel because the cartels quit creating illicit fentanyl separate from the fentanyl that's poisoning our kids today. I know, which it could even be worse. I know there are also those who believe the emergency scheduling order didn't lead to reduction in overdose deaths, that this bill before us won't effectively address the issues we're facing. To both of those criticisms, this bill stops these analogs from being produced in the first place. Right after the class-wide ban was put in place, the number of fentanyl analog encounters dropped nearly 89%, more than 6,200 fewer reports of analogs. DEA officials stated that the class-wide scheduling contributed to this dramatic drop. It also includes provisions to facilitate more research into detection of fentanyl in substances and potential treatment of fentanyl poisonings, something that has much more red tape in the status quo. I'm happy to see the White House supports 2 main provisions of the HALT Fentanyl Act. The HALT Fentanyl Act is one step of many this body needs to take to address the end of the overdose crisis. The time to permanently act is now, and I urge my colleagues to vote yes on H.R. 467, and I yield back.